Welcome to the deep dive. Today, we're plunging into something really fascinating. We often think of nurses as, the backbone of healthcare, right? But their influence, it actually goes way beyond the bedside. How often do you think about their impact on, say, community health or even wider society? Well, today our mission is basically your shortcut to understanding the actions nurses are taking right now. We're focusing on how nurses are really charting a path towards health, equity, and well-being for everyone. And our guide for this deep dive is a really powerful book called Taking Action: Top 10 Priorities to Promote Health Equity and Well-Being in Nursing. It's by Susan B. Hassmiller and Gay A. Daniel, but with contributions from, so many other leaders in nursing. We're going to unpack the biggest insights, showing how nurses are really positioned to lead change, tackle these longstanding inequities, and even transform healthcare.
Yeah, it's a really important piece of work. And it kicks off with this sense of optimism. There's a quote in there from Terry Fulmer, who's very respected, PhD, RN, FAN. She says, "Multi-sector collaboration is the essence of our practice, steeped in a long tradition of caring for those in need, with a keen eye for health equity and the eradication of racism, sexism, ageism, and all of the ways we as a society diminish those around us." That keen eye she talks about, that's really what this deep dive is exploring, how it translates into, well, action.
Okay, so action. But why is there such urgency now? What's driving this focus on health equity? The book points straight to the COVID-19 pandemic. It basically held up this really stark mirror to the health disparities that already existed in the US.
Exactly. It wasn't new, but suddenly it was undeniable. We saw how it disproportionately hit the elderly, people of color, folks in rural areas, just laid it all bare.
Yeah, the numbers are just staggering. Over 1 million deaths in the US from COVID. And then there's the parallel crisis, the mental health and educational fallout, especially for young people, which we're still dealing with.
Right. And that massive disruption, that tragedy, it really forced a conversation about what health equity even means. The authors use Dr. Kamara Jones's definition, which I think is really helpful. She defines health equity as the assurance of the condition of optimal health for all people.
Assurance of the condition. Okay.
Yeah, and importantly, she stresses it's not like a finish line you cross. It's a process, something we have to keep working towards. It's about making sure everyone actually has the opportunity to be as healthy as possible.
And this is where nurses come in, right? Because they're in such a unique position. They're the largest healthcare profession in the nation and consistently one of the most trusted.
Absolutely. That sheer size, that trust, and their presence, everywhere in the community.
Yeah.
It puts them in a perfect spot to tackle these big structural problems. They're crucial for moving things, like the book says, beyond conversation to action.
Okay, so if we're moving to action, where does that start? The book argues it has to start from within nursing itself, with education.
Yes, transforming nursing education is a huge priority. They talk about decolonizing the curriculum, which means things like structural and social determinants of health shouldn't just be in one, like, cultural competence class.
Right, it needs to be everywhere.
Exactly, woven through all the courses. The idea is that future nurses just naturally practice through this health equity lens. It becomes second nature.
That makes sense, sort of baking it into their thinking from day one.
Precisely. And alongside education, there's the whole issue of diversity, especially in leadership roles. While the direct care workforce is getting more diverse, leadership hasn't quite caught up.
And the book shares some stories that really drive this home, doesn't it?
It really does. Take Lena Gould's story. She's Ed D, CRNA, fan of Diana, incredibly accomplished. But her journey, wow. She faced huge barriers, couldn't pass the SAT initially, no transportation sometimes, even got conditional acceptance to her nurse anesthesia program because of a GRE score, despite, graduating with high honors.
That's incredible. And it highlights how these aren't just individual struggles, they're systemic barriers.
Totally systemic. And her success story also shows the power of mentorship. She credits Goldie Brangman and Dr. Arthur Zwerling for helping her navigate all that. Strong mentors were key.
And look what happened. She then created this immersion model.
Yes. The immersion model for diversifying the nurse anesthesia programs, it's helped, over 650, maybe 658 nurses of color get into and graduate from these really tough programs.
That's tangible impact right there. It shows mentorship isn't just nice, it's a strategy for equity.
It absolutely is. It's an action.
Yeah.
And you hear that need for support echoed elsewhere. Derek T. McCoy Jr. talks about feeling like the black sheep in a rural hospital setting. That feeling of isolation, lack of representation.
Yeah, that must be incredibly difficult.
And Frida Hopkins Outlaw puts it very directly. She says, organized nursing must eliminate racism from its own structural systems. By becoming more socially just, diverse, equitable, and inclusive. It's about cleaning house, essentially.
Okay, so change from within, education, diversity, mentorship. How does that then translate into action out in the community with patients?
Well, the book tackles a really stark example.
Mm.
Black maternal mortality.
Uh-huh. A true crisis.
Mm.
The statistic is just shocking for that. Black women in the U.S., their maternal mortality rate is almost 3 times higher, 2.9 times actually, than white women.
That's devastating. And the book talks about centering on the margins. What does that mean in practice?
It means instead of designing solutions from the top down, you start with the people most affected. You design interventions with them, often partnering with community-based organizations that already have trust and understanding.
Right, working with the community, not just for them.
Exactly. And there's this powerful personal story shared. I believe it was the COO at the Institute for Healthcare Improvement. Her own family history involved childbirth tragedy, losing a brother. That personal connection just fueled her commitment to fixing this. It makes it very real.
It really does. And it links back to how nurses understand the context of people's daily lives, right? How life interacts with health. Absolutely. Whitney Fear makes a really critical point about this. She points out that minoritized groups are too often just seen for their risks, at-risk populations, and not often enough for what strengths and insights they bring to the table, what they could offer the profession.
That's a subtle but really important shift in perspective, focusing on assets, not just deficits.
Yes. And Fear uses loan repayment programs as an example. They're presented as a solution, right? But she argues they can sometimes miss the deeper issues, like the educational inequities that created the debt burden in the first place. It's treating a symptom, maybe.
Okay, interesting. So it's about looking at the root causes.
Which brings us neatly to data. Because how we collect and use data is a huge part of identifying or sometimes obscuring those root causes. Rachel Walker's work on redistribute power over data, definitions, and decision-making is so relevant here.
Redistribute power over data. Tell me more.
Well, the book warns about data bias and what Walker calls deficit models. This is where data is sort of normed to the dominant group, usually white, middle class, etc. And anyone outside that norm gets labeled as other or deficient.
And that can have real consequences in care, can't it?
Oh, absolutely. There's this vivid example in the book, a nurse who had never smoked a day in her life, kept getting counseled about smoking cessation because her electronic health record incorrectly said she was a smoker.
Wow, just a data error, but it completely shapes her interaction with the healthcare system. And undermines trust, surely.
Exactly. It erodes trust. Walker actually talks about needing algorithmic reparations, which means not just fixing biased data, but giving the communities most affected by that data more control over how it's collected, how it's defined, how it's used.
So it's about shifting power. Justice in data is about power.
Fundamentally, yes. And nurses are right there at the front lines of collecting and using this data, so they're key to making it more equitable.
Okay, so we have education, care delivery, data. How do nurses pull all this together for, collective action, broader change?
Collaboration is key. The book shares this really honest lesson from a legislative effort that didn't succeed. The takeaway was blunt. If we are going to go, we must go together.
Go together, makes sense. So how do you build those strong coalitions for health equity?
Well, the book lays out some key ingredients. Find partners who have overlapping interests. Maybe they serve the same people or share core values. Be really clear about the problem and what you're proposing as a solution. Bring in other healthcare providers, not just nurses. Think about the business angle: employers, insurance payers.
Right, get buy-in from different sectors.
Yeah, and aim for political balance if possible. And crucially, be willing to support other groups' initiatives, too. It's got to be reciprocal. Build bridges.
Are there examples of this working well?
Definitely. Look at Health Impact's VaxForce program. They needed to vaccinate farm workers in rural Sacramento County during the pandemic. So they partnered with La Familia Counseling Center, a local community organization that already had deep trust within that community.
Leveraging existing trust. Smart.
Essential. It wasn't the health system parachuting in, it was a partnership. Another great one is Adriana Perez's program, Tiempo Juntos por Nuestra Salud. It's for older Latinos in North Philadelphia dealing with mild cognitive impairment.
Tiempo juntos. Together. Time for our health.
Exactly. And the whole program reflects community values. There's this saying they use. Poco a poco juntos llegamos lejos. Little by little, together we go far. It's all about that community-led, collaborative approach.
These examples really show nurses acting as that glue you hear about, right? Connecting different parts of the system and the community.
They really are.
Yeah.
Their reach goes way beyond the hospital into schools, neighborhoods. They understand people. They understand communities. That makes them natural bridge builders for this kind of work.
Okay, let's shift gears a bit towards the future. Disasters, innovation. How do nurses prepare for what's next? Their role in disasters certainly became very visible recently.
Hugely visible. And they bring those core nursing assessment skills to incredibly chaotic situations. There's a story about a faculty member who was hesitant about volunteering at a tornado shelter.
Yeah, I remember reading that.
And afterwards, she was like, no, thank you. I received so much more than I gave. It speaks to that deep connection and impact. And the book also mentions things like heart math strategies to build resilience for nurses themselves in these high-stress environments.
Which is crucial, but disasters also expose those underlying inequities again, don't they?
Always. It's a historical pattern. Think 1918 flu, polio, HIV/AIDS. Public health crises always shine a light on the cracks in the system, the existing disparities. COVID just did it on a massive scale, revealing, as the book says, vulnerabilities in the nation's ability to handle a national-scale crisis.
So how do we get better prepared? How do we think upstream?
Upstream thinking is key. The book talks about using the Plan-Do-Check Act, cycle PDCA, for preparedness. It's about continuous improvement. Plan something, try it, check the results, act on what you learned, and repeat. Hope Williamson-Yancey's experience leading a U.S. Army field hospital during COVID is highlighted.
What were the key lessons there?
Things like transparent communication, really strong cross-sector collaboration, having everyone pulling in the same direction, unity of effort. But fundamentally, it's about addressing those deeper economic, political, environmental factors before the crisis hits. That's real preparedness.
Building resilience into the system itself.
Exactly. Not just reacting when things go wrong.
And technology played a huge role during the pandemic, accelerating things, but also highlighting problems like the digital divide.
Yeah, double-edged sword. COVID definitely pushed tech adoption, telehealth, remote monitoring, all that. But it also made it painfully clear who didn't have access. Nurses are right in the thick of innovating here, though. Creating contact tracing teams, using chatbots for symptom checks or education.
Virtual care, too, right? Like for maternal health.
Yes, virtual maternal and newborn care, trying to bridge gaps in those maternity care deserts. Telepsychiatry, remote monitoring devices, lots of potential. But the way we implement tech matters hugely.
How so?
The book emphasizes using frameworks like human-centered design, equity-centered design, even liberatory design. These are approaches that actively try to involve marginalized communities and dismantle oppressive structures within the design process itself. It's about digital inclusion.
That makes sense. Not just rolling out tech, but thinking about who it serves and how.
Exactly. And Mary Joy Garcia Diaz's example is so powerful here. She's a Filipino immigrant, a nurse informaticist. She points out that Filipino-American nurses had a mortality rate 30% higher during the pandemic.
30%? Wow.
Yeah. And yet, often, CDC data didn't even separate Filipino data from other Asian groups. It was invisible. Garcia Diaz argues this shows a lack of diversity in tech development and data collection itself, which breeds mistrust and allows disparities to persist. We need inclusion at every step.
That really underscores the need for diverse voices in designing these systems. All this work, the innovation, the advocacy, the frontline care, it takes a massive toll on nurses themselves. The book addresses burnout, right?
It has to. Burnout, PTSD, this expectation of constant self-sacrifice.
Yeah.
It's a huge problem in nursing. The message is really strong. Self-care is not selfish. You simply can't provide good care if you're running on empty.
Can't pour from an empty cup.
Exactly. And burnout isn't just bad for the nurse, it's bad for patients. It can lead to errors. So investing in nurse well-being isn't just, a nice thing to do. It's essential for quality care.
And it's not just about individual nurses doing yoga, is it? It's systemic, too.
Absolutely systemic. The book stresses it's not either, it must be both hand. Yes, individual strategies matter, but employers have a huge responsibility too. Things like business employee resource groups, stress first aid training, offering financial education, support for family needs.
Creating a supportive environment.
Right. And tackling the stigma around mental health is also critical. Nurses worry about their careers, their licenses if they seek help. We need systems that make it safe and acceptable to prioritize mental well-being.
Okay, so we've covered education, care, data, collaboration, preparedness, tech, well-being, a lot of ground. The final piece seems to be about amplifying the nurse's voice in all of this.
Yes. Unmuting the nurse, essentially.
Yeah.
The book argues that the nurse's voice is already everywhere. It's in Congress, on farms, in corporate boardrooms, at protests. Alison K. Hernandez puts it perfectly. Nurses transform evidence into action every day by using their voice to advocate for patient needs.
Transforming evidence into action through voice. I like that.
Because they see the impact of policies or lack of policies firsthand every single day. They have that ground level credibility. And you see this in initiatives like Edge Runners.
Edge runners, tell me about that.
It's this initiative that recognizes specific nurse-led programs that are shown to cut costs, improve care quality, and boost patient satisfaction. Often they do this through things like providing social support, culturally sensitive care, really building trust. It showcases nurse-led innovation in practice.
That's fantastic. Real-world examples of nurses leading the way.
And think about school nurses during COVID. Talk about amplifying voices and taking action. They were, as the book says, building the plane as we are flying it.
Yeah, I bet that felt true.
Sewing masks, setting up online health offices, running virtual support groups for kids and families. Just incredible adaptability. And the blog, The Relentless School Nurse, its readership apparently exploded from thousands to over 300,000. It's amplifying a voice.
Wow. Sharing solutions and experiences on the front lines.
And it's vital to see this current activism as part of a much longer history. The recent National Commission to Address Racism in Nursing, which started in 2021, didn't come out of nowhere. It builds on the legacy of figures like Dr. Mary Elizabeth Carnegie.
Who fought segregation in nursing associations.
Exactly, and documented the contributions of Black nurses. Or Henrietta Villascusa, who advocated tirelessly for Hispanic and Latino communities at every level of government. Nurses have always been advocates pushing for justice.
That historical context is so important. It's not a new fight.
Not at all. It's a continuation, maybe with new tools and urgency.
So, wrapping this all up, it seems incredibly clear from this deep dive into taking action that nurses are doing far more than just providing care. They're actively reshaping education, they're tackling systemic inequities in care delivery, they're harnessing data, building coalitions, innovating with tech, influencing policy.
It's a multi-front effort. They're truly stepping up as architects of a healthier, more equitable future, moving from being the backbone to being maybe the strategic planners and builders.
A powerful shift. Okay, so as we finish, let's leave our listeners with something to think about. We've talked a lot about nursing's unique position, that trust that reach into every corner of society. So the question for you is, given everything we've discussed, what intentional action, even if it feels small, could you take in your own life, your work, your community to help foster greater equity? Remember that idea of centering on the margins, challenging the status quo. Sometimes the biggest changes start with one thoughtful step.